Okay, Christmas edition 2019. Ask a special education attorney, and I'm going to answer a few questions in a festive kind of manner. But this one, this is it says specifically for Alabama, but actually this would be relevant in most places. Okay, as far as most states. Can a student with an ASD diagnosis who has been prescribed ABA by a medical doctor be excused from missing school to receive treatment? Yes, absolutely. At the same time, and hold on. Sorry. Those were prescription. These are not. I know they look like they're prescription, but they're not prescription. So don't ask me where I got them. And you may be able to go to Pearl Vision and make them prescription, but these are not. So, yes, if your child is prescribed ABA, for example, and you establish a time for them to get their therapy, then yes, those can be excused. At the same time, this would be, because we face this a lot, okay, in multiple places, to where the parents, it's easier for parents to find availability during school hours for things like ABA therapy. But the problem with ABA therapy is it is a consistent appointment. Like, I'm talking multiple times a week, and at that point, it's going to be harder and harder to reconcile the prescription with the excuses, because at the same time you would have an IEP. You also have state mandates with regards to instruction, things of that nature. So yes, you can. It would be treated like any other doctor appointment at the same time, or doctor prescribed need, but understand that there is that tipping point, and ABA is one of those things that you sort of need to do a lot, and it would be a recurrent appointment. I've seen some schools be totally cool with that, depending on the age of the child. Others are not cool with it, because then it ends up screwing with instructional time, and then the school doesn't like that because of compulsory education laws and board policy. So what do you do? See, this is always my conundrum. My daughter has always received her behavior analytic services inside of her IEP services and as part of her IEP. And therefore, we haven't gone out to go get those kind of things privately. There hasn't been a need because it's been incorporated into her IEP program. And if you're receiving that private therapy, my big question is, if your child needs that therapy inside or privately, then that also sort of indicates to me that they also need it as part of their free and appropriate public education. And there was one parent that, she was like, look, they had a new special education director, and the special education director, tried to, I guess, assert his authority and tell her that he was no longer going to be recognizing the excuses or the prescription for the ABA that was occurring. And so she was checking him out, I think, 30 minutes early every other day, which, you'd think, well, what's the big deal about that? Well, he wanted to make it a big deal as a new special education director. And so what I advised the parent to just write him a letter saying, look, if you want to change what I'm doing and getting private therapy, then fine. Tell you what, you guys, let's just have you pay for it and have it incorporated into the IEP, and you guys provide the ABA. Well, he changed his mind real quick and decided that it was fine for her to continue to check him out early, because he didn't want to pay for the ABA and he didn't want to have it incorporated into the IEP. And that particular parent was okay with that. But, there are other parents out there that, paying for things like ABA therapy or a lot of speech therapy creates a financial burden on the family and also on time. That is entirely the reason we have a free and appropriate public education. And I do have these constant arguments inside of with our public schools with regards to what speech language therapy should be with regards to a school system. Same thing with occupational therapy and PT. And, so many schools have been taught, and educators have been taught in trainings that, these things are only supposed to be educationally relevant with regards to the therapy that they give to children. That is partly true, but wholly false, okay? The educational environment for all children, take out the ones that don't have need for an IEP period and don't have any issues. School is still a therapeutic setting that our society uses to train our children to become good, tax-paying, skilled citizens. All right? It is a therapeutic environment to where we provide flexibility for them to screw up and do things that as an adult could be a crime, could be unacceptable. We allow that kind of latitude for children to screw up and make mistakes. Those are called corrective moments and the teachable moments. Because there is a huge aspect inside of our education system of social emotional development. That's why we create goals for it. Functional skills, okay, communication. See, those things are all educationally relevant. Academics is just the fourth prong. So if all of these other things are educational performance areas that we write goals for, and then you have the related services, well, you'd be hard pressed to sit there and tell me that occupational therapy and speech language therapy, PT, or ABA therapy do not have a direct correlation over to having a child rehabilitate, acquire brand new skills where skills weren't there before in these areas for which educational performance has been defined. All right. So that's why, when parents go, well, I want, a doctor's excuse, so that I can take my child to ABA therapy. My question to them is always, why isn't that inside your IEP? Why isn't the school providing your child ABA therapy inside their IEP and as part of their services to help with skill acquisition or behavior reduction and skill acquisition? Because a lot of school systems only look at behavioral analytic services as some component to deal with bad behaviors, maladaptive behaviors, whatever. No, that's a sliver of what they do. There's also the skill acquisition side. And the skill acquisition side, quite frankly, is what helps with the behavior reduction. They have to go together. All right, so also, if there's complaints coming from the school that these things are occurring within the school setting, a lot of our kids have difficulty that have developmental disabilities that would benefit from things like this. They have a difficulty generalizing. They're good therapy kids, not really good at applying that in multiple settings. So you should really be getting it in both places if you have it. But this is where, you need to walk real softly. And yes, the technical answer would be yes, if it's prescribed, you should be able to get excuses. But at the same time, the big warning sign is going to be that you have board policy on attendance, state law with regards to compulsory education and instruction and how much instruction your child needs. Then you're butting up against how much instruction is embedded into the IEP. And can the IEP team provide your child a FAPE if you're unenrolling or if you're taking your child out or early dismissal in order to get them therapy? And if you're sitting there going, well, if they would provide it, inside their IEP, exactly. Okay? So, that's sort of the nuts and bolts and all the nooks and crannies in there about that. And that's my answer.